So welcome everyone. My name is Anjay Rastogi. I'm a nephrologist and pharmacologist at UCLA. And this is our first program on a live chat with myself and also my expert team. And you'll be meeting a few of them today, but every month we'll be having it at the same time, 5 to 6 p.m. PST. And please do send your questions in advance if possible. We already have received a lot of questions today, and we try to group them together. So there's a theme, there's a flow, and we'll be going over them one by one. The questions that we are not able to answer today, and there will be quite a few because we have so many questions, we will be addressing them at our next one, next month, August 1st at the same time. So with that, just wanted to mention our Core Kidney Health Program, which is a comprehensive kidney care program at UCLA and has following globally at this point. And before we get into the slide deck, I do want to put a disclaimer. All the information that we'll be sharing today is for information only. Please do not make any changes in your healthcare or plan unless you talk to your healthcare provider. I think that's very important. My patients would always know that I say ask as many questions as possible. Ask me, ask your team, ask your healthcare providers, but don't make any changes because what we see here is might be a general description, and there might be more specific details that they will need before making a decision. This is our contact information. You can call us. That's our direct office line, 310-954-2692. Email us at Core Kidney. All of you have emailed me already. So please keep on asking questions. We have a website too. Our undergraduate health club, Brewing Beans, is working very actively on this website. And also follow us on Facebook. We will be posting, will be posting a lot of very useful information, not just for our kidney patients, but also their family, friends, and caregivers at the same time. This is the website that I mentioned. There's a lot of information. I know there were a lot of questions on kidney transplant that I was asked as well, including living kidney donation. So we did have our previous webinar last month was on living kidney donation. We're trying to see if we can actually post it. But if we can't, we will be going over some of those questions in our next few sessions. Also, this was our Core Kidney Conference, health conference that we did in March. March is Kidney Month, and we do it annually. And this is actually posted on our website. And this is exactly what I was talking about. We had Philip Palmer, who's the news anchor for ABC7, was a moderator, and he's actually a living kidney donor himself. And we had different experts participate, Dr. Danovich, Dr. Norris, Dr. Uslan, and Dr. Amy Weimar. So it was a very interactive and powerful session that we had on that day. And these are our upcoming events. As you can see, there's going to be first of every month, so you don't even have to remember. Tune in at 5 p.m., first of every month, Pacific Standard Time. And this is our mission statement. Our mission actually is to make the patients their best advocates. There is nobody better than yourself who knows your body. So you should be your best advocate. And how do you become advocate? By education, by learning, by talking to other people, by talking to people who have been through this process, not healthcare providers like me, but patients and their caregivers. And we'll have two very powerful statements today by a patient and his caregiver. So it's all about empowering our patients. And if we don't have the answers, we will find somebody who can, and we will get back to you. The green ribbon stands for kidney disease, and the Green Ribbon campaign was started by the Circle of Core at UCLA in 2016. And this is catching on, but we still have a very long way to go. And this is our Circle of Core. So this is our patient advocacy and support group. And these includes both kidney donors and recipients and patients with kidney disease. They're not on transplant or dialysis yet. So if you have any questions, please do feel free to ask us, and we can connect with any one of them. Today we'll have Marc, who will be participating, and a significant other. And the third one that's not here is Mr. Jim Cunningham. So we'll have to add his picture here as well. So before we get into the slide deck, just on some of the things that we stand on kidney care, 15% of the adult US population has kidney disease, some form, and the key thing is most of them don't know they have kidney disease. And the reason for that is in majority of patients, kidney disease is silent. I was just yesterday giving a presentation, and the manager was there and was chatting with me and says, "What is this talk about?" And I says, "About kidney disease." He says, "Oh, I have diabetes. I'm type 2 diabetic. I've been diabetic for 10 years." And my first question to him was, "Do you know what your GFR is?" And he was looking at me like I had asked a very absurd question. And he says, "What is that?" And then I explained to him, I said, "Well, when you come to my presentation, you'll hear about GFR. But I said, I want you to find out your GFR." He finally got his GFR back with me by the end of the presentation, and it was actually on the lower side. And he had no idea that it was low. So anyways, being proactive, and the only way in majority of cases you can find out the change in your kidney function is by a lab test. And this is something that we saw during the COVID pandemic. A lot of people did not go to the clinic because of the scare, because of the fear that they might contract COVID if they go to the clinic or the hospital. And now some of them are coming back with significant worsening kidney function. And the reason for that is that kidney disease was silent. They just thought that, oh, we're fine, we don't have any symptoms. But the important point is you have to be proactive in your care. We'll be hearing from Marc in a lot more detail how he was so proactive in his care. But making sure that you go for your appointments, you follow up with your labs, and don't miss them. It should be on your calendar. And if you can't go it, your caregiver should make sure that you do. We're talking about the dialysis patients. About 130,000 patients start dialysis annually. These are new starts on dialysis. 500,000 patients are living on dialysis, and about 200,000 patients have a kidney transplant in PAC. So the disease burden is quite significant. And besides the mortality and morbidity, the cost factor should not be forgotten. It's one of the biggest drivers of cost. And this cost that we're spending on this should be spent more on preventive care or preventative care. So anyways, just something important to keep in the back of your mind. This actually is quite important. About 1/3 of ESRD cases, end-stage renal disease cases, have never seen a kidney specialist prior to starting dialysis. So a point that I always make to our patients is that it's not just the fact that the patient is ending up on dialysis. Their path to dialysis is sometimes equally, if not even more important. And your pre-dialysis care, the care that you have been given, and the care that you took care of yourself are actually very, very important. And they will decide what your outcomes will be on dialysis and transplant. So it's very important that you take care of yourself and provide the right team. The first 3 months on dialysis has pretty high mortality. We spoke about that. 5-year survival in dialysis patient is less than many common cancers. Why am I mentioning all these things? And so we need to take care of our kidneys. We need to be proactive. Our kidneys are our kidneys, but the next best thing would be kidney transplantation. One of the questions that we did get asked is about was kidney transplantation. And the question was that if I don't have a living donor, is it better to wait for a living donor or get a deceased kidney transplantation? And the short answer is the transplantation will be better than dialysis in any setting. In majority of settings, there are some conditions in which it might not be. So if you do have, but do talk to a healthcare provider and look at the pros and cons. In majority of patients, the living donation is still not that common, maybe less than 1/3. So most of the patients will be getting deceased kidney transplant. So if you are called for that, you should go for it. But we'll also speak about how to ask for a kidney or the ask, and what's the right way to do it. And so we'll be going over that as well. We spoke about the annual cost and home dialysis. If you are getting close to dialysis or around dialysis and you're not on home dialysis or have not been offered home dialysis, then you need to really ask the question from your nephrologist, why? And if there is no good reason, I would strongly recommend to get a second opinion. And at UCLA Health, we have a whole team of nephrologists throughout Greater Los Angeles area who would be very happy to guide you through. At UCLA, we are home first. So we're transplant first, but till transplant happens, it's home first. And the waiting list that's ever growing. So anyways, for all these things, the Advancing American Kidney Health Initiative was passed, and the focus was slowing down progression of kidney disease. We'll be touching on that on a bit more detail today, increasing home dialysis penetration and more kidney transplantation, especially preemptive transplant, that you get a transplant even before you get on dialysis. So with that, I'm going to go over the first group of questions that I was asked is about potassium. So that was an overriding theme in the question that we got, that how much potassium can a patient with kidney disease have on a daily basis. So before we answer that question, let's get back into what potassium is, and this slide deck is being contributed by Anika Dhingra. She is one of our undergraduate Bruin Beans, and she's absolutely fantastic, and she put these slides together. So a guide to the basics of potassium. So the two things that I put over here are tomatoes on the left upper corner and bananas on the right lower corner. And potassium is a very important electrolyte and mineral in our body. And it's ubiquitous, is present in all foods, but some more than the others. And these are foods that are very high in potassium. So when you're looking at potassium in your diet, and this information is widely available. I normally don't say get information from the internet or Google, but for this one, especially if you go to reputable sites, you can find out which foods are high in potassium, and those are probably ones that you need to avoid. But let's get back to that in a bit more detail, because the amount of potassium that you can ingest are dependent upon a few things, and we'll be going over that. So potassium, like I said, is an essential electrolyte in our body and is present in many or almost all the foods that we eat. And some of these sources are listed over here. The important point to keep in mind over here is fruits and vegetables are high in potassium. Most of them, not all, some of them are actually low as well, but they tend to be higher. And that's why it's food that is healthier, and plant-based diet is overall healthier than a meat-based diet or animal-based diet, especially for a kidney patient, both from a perspective of kidney disease and also cardiovascular disease. So when you limit potassium in your diet, you will also be limiting some of the other healthy foods that you're taking. So talking to a good dietitian, nutritionist, or even your healthcare provider, they should know a lot about the food as well. They probably will not be able to give you a recipe, but they can guide you what to eat and what not to eat. So like I said, potassium is a very important mineral and electrolyte in our body, and it plays a very central role in the functioning of the heart, the nerve, the muscles, the metabolic functions. So the list goes on and on and on. So it's very, very important. And both low and high potassium can be dangerous to the human body. This is a very important point to keep in mind, because we tend to focus on the high potassium because patients with kidney disease tend to have higher potassium. But keep in mind that a lot of patients, even with kidney disease, might have low potassium. And in those patients, you have to give potassium back to them. And one case is patients who are on a type of home dialysis called peritoneal dialysis, PD. They tend to run low potassium. And in those patients, sometimes we have to give potassium back. This is one other reason to be on if you're on dialysis, to be on PD, because you can eat a lot more potassium as opposed to a lot of our kidney patients with advanced kidney disease who have to limit potassiums in their diet. So potassium is very important. Both low and high potassium can be bad. So what is a normal potassium level? So this depends upon your lab. Every lab has a bit of a different calibration, but more or less they're the same, but it might be 0.1 here, 0.1 there. So the ask from you would be, when this program is over, you should go and check your labs and look at potassium levels. The normal range, this is our lab normal, 3.5 to 5.1. Anything above that is high, anything below that is low. And we want to avoid both of these. And high potassium could be mild, moderate, or severe. Now, why is high potassium bad? And I think that's a big thing that we're asking. The potassium, as you know, is, and I mentioned, is very central in the functioning of heart. And high potassium can cause cardiac arrest. It can stop your heart in the track. Actually, the lethal cocktail that is given to people when they it's a death sentence. The lethal cocktail, the key ingredient of the lethal cocktail is potassium. And I, if you look at my presentation on drugs and medications, what is the difference between a medication and a poison? And one of the key differences is the way we use it. Potassium, if you give it in a regulated amount, is actually an essential nutrient for our body. But if it's given too rapidly, it can put your heart or stop your heart completely. And patients with kidney disease, if they have high potassium, it can cause cardiac arrest. Now, the other important point is that hyperkalemia, which is the other name for high potassium, the disease tends to be silent. It does not cause any symptoms. So it's sometimes vague symptoms, weakness and stuff, but the majority of people will not have any symptoms. And so it could be very misleading. And that's once again the reason why you should watch your potassium very carefully and closely. But what kind of patients actually become hyperkalemic? And these are some of the reasons why a patient, number one is kidneys. Kidneys are the ultimate organ that get rid of potassium from your body. So any patient with advanced kidney disease, and this is important. So it depends upon which part of the spectrum of chronic kidney disease. As you know, it could be stage 1 to stage 5, and stage 1 and stage 2, most of them will have enough kidney function to eliminate potassium. But it's the advanced stages, especially when you have stage 4 or higher, that's when the kidneys functions get limited to excrete potassium. And then, so what is your potassium intake should be? Normal potassium intake, 4 grams, 5 grams a day in a high potassium diet is actually recommended. That's with your normal kidney function. But if you have advanced kidney disease or even moderate kidney disease, then there are a couple of things that will decide. Number one is, what stage you are in, but also what is your potassium levels? That's something that you should talk to a healthcare provider. If your potassium levels are low normal, then you probably should be eating, usual amount of potassium. And if it's low, obviously eating more. But then if it's higher, then you have to limit your potassium intake. Diabetes is a big driver of high potassium. So if you have diabetes and you have kidney disease from diabetes, then you're at higher risk. And congestive heart failure is the other reason to have high potassium. But there's some medications that can also cause high potassium. And the two of them are listed over here, called RAS inhibitors, renin-angiotensin-aldosterone system inhibitors, and beta blockers. Now, these are two life-saving drugs. RAS inhibitors for patients who have kidney disease, heart disease, diabetes, and hypertension, and beta blockers more for patients with heart disease. So these are life-saving medications. They can raise your potassium a bit. And this is the time that you need to talk to your healthcare provider and discuss with them that how can you still be on this medication. If you have kidney disease and diabetes or heart failure and you're not on the RAS blockers, which could be ACE inhibitors or ARBs, then ask your healthcare provider why you're not on them. And if they say that it's because of high potassium, then you need to talk to them. Is there any way you can lower potassium and keep them on these medications? Now, reading a label is very important, and this gives you a lot of information. So the nutritional facts, 8 servings per container. So the serving size is important. Sometimes we don't see this, but this is per serving. So make sure that you keep this in mind and not have the whole thing at one go. And then we have fat, we have cholesterol, sodium, carbohydrate, protein, and then you have potassium over here. So 235 milligrams, and basically saying 6% of your daily recommended value. And like I said, but this is with a normal kidney function. And I don't think they mentioned this over here. So if you multiply this to about 100%, will come to 4 to 5 grams, like I mentioned. But if you have kidney disease or are hyperkalemic, then you have to lower it furthermore. So potassium levels are important for you to check. And this is keeping track of potassium on nutrient labels, what's medium, what's high, and what's very high. And percentage is based on a US food labeling of 3.5 grams every day. So once again, another important reason to read labels on the food. But what if you're eating food that don't have labels, and hopefully those are the foods you're eating, fresh vegetables and fruits, then you can go by the list of the high and the low potassium levels. And these are some of the low potassium foods, and these are some of the high potassium foods. Now, the low potassium foods are important, and those are better, but quantity is important too. So if you eat a lot of low potassium foods that have a significant amount of potassium, then it could become potassium overload. So anyways, I think that's something important to keep in mind, and looking at not just the quality, but also the quantity of what you're eating. So how do you manage a high potassium level? The first one is to identify the cause of high potassium. If you're on a high potassium diet, you're taking non-steroidals like ibuprofen and Motrin that are causing high potassium. You're taking some other medication that is causing high potassium. Then you need to look at if those are modifiable, with the understanding that you don't want to be off medications that are life-saving. Obviously, if you have to be, you have to be, but you have to give it a fair chance that you can stay on those life-saving medications. Follow a low potassium diet. Now, the challenge with following a low potassium diet is that, number one, these high potassium diet overall tend to be healthier. That's one. But number two is, it's very difficult. And one of the questions that I always get from my patients is, I'm diabetic, I have heart disease, I have kidney disease, what can I eat? So it becomes very, very tricky to do that. And on one of our sessions, we're going to bring a dietitian in who can discuss this in a lot more detail. Add diuretics. Now, diuretics, you have to be careful. They might have some of their own issues, but that's one way to add, especially like drugs like Lasix. The fourth point is potassium binders. Now, we have binders. Some of them are actually very good. They're safe, effective, and tolerable. So as your healthcare provider, if your potassium runs consistently high, then would you be a candidate to take this potassium binder? Now, these binders are oral medications that bind potassium in your gut and prevents that potassium from being absorbed. Dialysis is the other way, and then there are other things as well that can be done in the emergency room that will lower potassium. But I think these are a bigger, higher level view of high potassium levels are maintained and controlled. Now, with that, I want to introduce Mr. Marc Coronel. So one of the questions that we got, so I'm done with the potassium portion. If there's any more questions about that, please do ask. But our next question was, how can I improve my kidney function, or how can I live healthy with kidney disease? So it's my real honor to introduce Mr. Marc Coronel, who is an amazing person, human being, and more importantly, a very dear friend of the Core Kidney Program, and one of the leaders of the Circle of Core Patient Advocacy Group. And he's going to share his story, what he has been through. So, Mr. Coronel, all yours.
Thank you, Doc. When you were doing this, speaking about the potassium portion, I actually looked at my labs, and I'm actually within range. I remember when it was in the upper range, and when I was on dialysis, I always itched when I had a lot of potassium in me. But my story started on my 26th birthday on a routine physical, and I was actually competing in the amateur boxing world, and this was my way to the pros, which then led me to fighting for my life after finding out that I was diagnosed with FSGS, which is a form of kidney disease that scars your kidneys due to leaking of protein. So I had to do a transition from fighting in the ring to fighting for my life, right? And I needed to have a certain type of mindset. And that mindset was, how can I bring the fighter's mentality of the discipline, waking up at 6 in the morning, then going to the gym around 10 to 12, and then resting and eating a good diet. One of the hardest things for me when I was diagnosed was I didn't understand the renal or the diabetic diet, which is very similar. And it was really, really hard for me to cope with it because I was eating red meat, I was taking protein shakes, and then everything cut in half. So with that, it was the mentality that I had to bring from there to something new. And in the boxing, you gotta move your head because you're gonna be getting punched a lot, and that's what kidney disease did for me. So what did I do to actually mentally prepare myself from being diagnosed? Obviously, I'm gonna go through a depressing state because it's something that I thought I was just gonna die, because hearing kidney failure and not knowing anything about it, you start to think, oh my God, well, am I gonna die? What is dialysis? Because that was also an option for me to do, and a kidney transplant. And this was when I was first diagnosed. So it really was how to get that mindset right. And what I've learned through the process of going through this is a battle that we are going to constantly keep going through for the rest of our lives, right? And after speaking to you, Doc, you told me we have 15 minutes with our doctor to get as much information we need about our health. And for the people who are listening today, that 15 minutes should be vital to you so that you can ask the appropriate health advice that can prolong the kidney failure. I was able to hold my kidney failure for 7 to 8 years till I ended up on dialysis, right? And that was through nutrition and diet, understanding labels, how much water intake was I supposed to do? Because once I ended up on dialysis, it was a total turnaround, right? So within that 15 minutes, I want to make sure that you guys are aware that don't talk about your problems of what you're going through to eliminate the actual real problem, which is the kidney disease. And after hearing Dr. Rastogi state that, I started to actually time myself to say, what type of questions do I need to ask, and are they understandable? Because sometimes medical terminology can be hard to understand. And through the process, you start, learning your terminologies. But in the beginning, ask those questions, have 15 to 20 questions ready to go, and know that doctors are on a limit to tell you because they have other patients to deal with. So with that, Doc, thank you so much for giving me that input, because it actually now puts my life into perspective when I do see my transplant team getting that 15 minutes out of the way to making sure that I am taking care of my health. And then I can talk about my life once my 15 minutes is up. Doc, are you there?
1 second. I'm here, Mark. I was just listening to all that he has said. I was putting some key points in the chat box as well. So, Mark, you had a very interesting journey, and being a boxer, giving that, what you thought at that time was a death sentence. You never didn't know what hit you, but then, like you said, you fell down, but you got up, and then you were fighting for your life, literally. And there were so many inspirational stuff that came out from your story, and I don't have enough time to discuss that because we only have up till 6 p.m. But there are a couple of things that I do want to ask, and I'm just going to put it out there. There are a lot of questions on transplant that are coming in, but we will discuss with them at a later meeting, probably the next one or the one after that, about how to ask, the social media, how you use that to get living kidney donors. And I hear you had 30 plus people wanting to donate to you. But the point that I want to ask today is, and these questions came in as well, about caregivers. your partner in fighting kidney disease. And as you know, for transplant, you have to take a caregiver with you, right? That's a requirement now, that there's somebody who will take care of you. So I would like you to talk more about that as well.
Okay, great. You know, my fiance was actually my caregiver, and she was there from the process, from the beginning, middle, and now. It's not the end. This is now. This is in the present time. But when we found out that I ended up on dialysis, she found me on the floor, and it was a very chaotic time. I was on the floor. I was in the bathroom. She came in. She found me on the floor. We went to the ER, and I automatically got on emergency catheter dialysis. And you know, our lives completely changed because we were giving this diet log, and she had to learn the full dietary program that I needed to be on to be, number one, successful with dialysis and successful with transplant. You know, there would be times where I would cheat, where I would intake more water, but I didn't know that in the beginning, which then I had to pay the price, where I would wake up my fiance in the middle of the night and say, we have to go to the ER. I'm not able to breathe. And essentially what happened was my body was retaining water, and instead of going to my legs or my face, it went right to my lungs, it was really hard to breathe when I would lay down. So she learned the renal diet, what potassium, salt intake, sodium intake, and that process was really, really hard because she started to get on that diet as well. Right. It was very, very, we found tips and tricks on how to eat without putting salt or pepper, but getting alternative things from Trader Joe's to make it more tasteful so that I can enjoy the meal, which then she got really, really good at. So I'm very, very blessed to have that, you know, and the thing about caregiving, right? And transplant emphasizes this a lot, is that bring your caregiver here so that we know that you're completely taken care of. And she was there all the way, making sure I was on my medications from 9 to 9 at night.
Mark, with that, let's introduce Cindy. I thought you were going to do that, but let me do that. So Cindy.
Thank you, Doc.
But stay on, Mark. We have questions for you still. Hi, Cindy.
Hi, Dr. Rastogi.
Hi. So thank you for joining, first of all. And the caregivers have a very important role. And before you speak, I do want to say one thing, that the caregivers should take care of themselves as well, because a lot of times I find that they get so invested in taking care, they forget about themselves. So I know a lot of amazing family members and friends who actually have dedicated their life. So Cindy, we would like you to speak for a few minutes as well, your experience, and also I'm sure a lot of caregivers would like to speak to you at some point, and if it's okay, we'll share your information with them.
Absolutely. Yes, so definitely, as you said, just being a caregiver to someone, you know, it's very important. You know, just that support and encouragement the patient needs. During that whole time, I was pretty much, you know, Mark's voice. I would go to all the appointments. I would ask the right questions. I'll do my own research, and you really have to be your own advocate. You know your body best. And, you know, just a lot of research, and just the kidney community itself is amazing to me. Just how much support you could get there. You know, there's people that unfortunately don't have that support system, but you could definitely find it in the kidney community. And, you know, I would ask all the questions. You know, I highly recommend the first, the second, a third, even a fourth opinion. Every doctor, you know, it's different, you know, patient's experience. It depends what your needs are. So we went to several different doctors, even out of state, just to get the proper care. And, you know, so I was able to compare the different type of care there is out there. And luckily, you know, we were placed in the perfect place where Mark had his kidney transplant at UCLA. And, you know, just being your own advocate. And as far as the diet goes, like he mentioned, my diet became his, which I think made it easier. You know, I'm not going to eat something that he can't have. So there's a lot of seasonings that they sell with no sodium, and different, you know, things that you do to like add flavor to the food. I was very cautious on the sodium intake. You know, I was trying to stay under 2000. The phosphorus intake, potassium, and so many things we couldn't have. And now him with his kidney transplant, it's amazing, how there's really no restrictions, but we're very mindful with the diet and, try to live a healthy life as
Great.
possible.
Great, Cindy, and I think you mentioned a couple of important points about being advocate as well, because a lot of times when patients have advanced kidney disease, there's something that we call uremia, that their cognitive function is not really perfect at that time, and I think that's really important that somebody is there to listen. Like I said, those 15 minutes. I mean, I want to enforce what Mark said, is those 15 minutes with your healthcare provider. You have those 15 minutes, you can do whatever you want with them. You can talk to them about weather, you can talk about golf, or you can talk to them about actually, what's going to help you, right? So I think that's very important, but also getting second or third opinions. But I also want to welcome Dr. Sumega Mohandasan, and Mark will know her very well because her husband took excellent care of Mark's family member. So she's joining us from Vegas as well. So just wanted to give a shout out to her. So thank you so much, Cindy. And I know you said you will be available. So if you have any questions for Cindy, please email us and we will connect you with her. And Cindy will be joining us in our future events as well. So thank you, Cindy.
Absolutely. Thank you.
And now I before we get into the next section, there's a couple of questions that are coming up, so I want to answer them. One is reach out to Miss Lisa Bonebreak. Miss Lisa Bonebreak actually runs the Alport Foundation. She's a very dear friend of Core Kidney, a great patient advocate, and she has a question. If a teenager a patient with Alport syndrome who has a quote unquote normal GFR of approximately 90, but still struggles with high potassium, what does that mean? Does it represent rapid progression? So that's a very good question, Lisa. And let me answer it because there's limited information here. So I would be very happy to discuss that with you more if I get more information. But what you have to keep in mind, when the kidney functions, and I don't have the nephron over here, actually, let me get that nephron picture, and then I can talk more. But in the meantime, I'm going to introduce Mr. Jim Cunningham. Mr. Jim Cunningham is a psychologist by training and practice, and is amazing at what he does. And doing this, so kidney disease causes a stress of its own, and I'm sure Mark can talk a bit about that as well. But the pandemic added a lot more to it. And it's very important. We always think about diet, we always think about exercise, but we should also think about our brain, our mind. And Jim, are you on?
I am.
Okay, great. Your camera's off. Yep. Oh, there we go. All right.
Okay. So just to say a few things, maybe to piggyback off what Mark had said. So clinically, what I normally do with kidney patients is I treat a myriad of things like generalized anxiety disorder, reactivity, depressive issues, major depressive issues, minor depressive issues. And clinically, I think everybody knows what those mean, but what really resonates with me, and I didn't have a lot of experience with donors, with recipients, with caretakers. To what Mark spoke about is one of the things. Can people hear me? Hello?
Yeah,
Can
we
you
can
hear
hear
me?
you.
Okay, good, because Christina, I'm on. I got it. Yeah, I like to use very much to the same degree Mark was talking about athletics. I was an athlete. I was a professional athlete actually at UCLA. And in terms of the things that it imbued, the skill set, it's like playing a tennis game. It's if you can keep your accountability level on your side of the court and take care of your own issues, your own nutrition, and have the self-soothing skills to see yourself through to the other end, I think that's how, to a large degree, you either survive or you don't survive. So you have internal skills, and that's pretty much what I do in most of my sessions. So does that resonate with Dr. Rastogi? Do you have any questions or?
No. Marc, would you like to add something as well, or?
The mindset is really, really, really important. I think, Mr. Jim, you emphasize that a lot, and we had an earlier discussion about it. And you know, a lot of the things within myself, if I didn't have my caregiver, my significant other there to lift me when I fall, right? It's really hard to come back from that. I was already depressed, and I would fall deeper into a more depressing state, and had her lift me up, right? Which really helped me with my journey going through kidney disease and kidney failure, because it just really, I had someone there, you know, that one person was there to listen about my problems, about what dialysis felt like, and she was there to just listen and hear. And that's what I just really needed. But there is a the core kidney group, we're here to listen. We're here to understand what you're going through, because a lot of us have gone through what you guys are going through, right? And we're here at all times of the day for you guys.
Well, and Marc, I totally concur with what you're saying. The interesting thing, however, is what was able to be elicited from you in your past, in your athletic background, and your, you know, the metaphor of boxing, I think is probably what saved your life. Whereas a lot of people don't have that, they don't have that history. And so that's one of the things that we choose to kind of bring into imbue their thinking process and their vocabularies. And, you know, you can call it postmodern. There's a lot of different ways to do it, but that's how you, it's all psychological. It's all psychological. And if you can get that piece, you can tap into that piece, I think you've got everything. And I think that's what you're alluding to.
Yep, and I think just staying positive is very important. I always say, have a job, go to school, keep your mind focused on things besides your illness. So those are very important. How to cope with stress, and it's always good to get professional help for that. Why? Because, you know, you can do things on your own, but you'll be experimenting. Talk to somebody who actually knows what they're doing, and they can direct you that, look, this is what you should be fixing, this is what you should be focusing on, and forget about this. So I think getting professional help is actually quite important, in my opinion, in this day and age. And this doesn't mean that you have a psychiatric illness. That's a different thing, right? It's just better strategy. Just like we eat better, you go and see a dietitian, you know. And
Jim.
Yeah.
Yes.
Oh, sorry. Go ahead.
No.
Oh, I was just gonna say, you know, I did have that outlet, but when you deal with these patients, what would you recommend if I didn't have any of that, right? If I didn't have the boxing, if I didn't have any of that stuff, and just briefly, I would like to know, like, what would you tell someone who's going through it that doesn't have that?
Well, I think you can teach people to develop self-soothing skills, internal skills. You know, you can start experimenting with things like living a more positive lifestyle, exercise. You know, it's a small conversation in the beginning, but the manifestation of it and the repercussions of doing something positive, it builds on itself. And when people see they feel better and they look better and their bodies are better, I think that's equates to a general overall better lifestyle and life choices. And survival rate, I guess, is, if you really ultimately want to put it into quantifiable terms.
Great. Thank you.
Thank you, Jim.
Thank you, both of you. So Lisa, let me answer your question. So these are your two kidneys, and they filter your blood, and the urine comes out and comes into the bladder. And this is your nephron. And I think this is really important to understand your question about high potassium. So the two ways, so the kidneys are the ultimate organ that that get rid of or excrete potassium. One is through filtration. That's your GFR, the glomerular filtration rate. And if this goes down, so does the potassium excretion. But the other important point to keep in mind is in this distal portion of the nephron, there's also potassium secretion. So there are conditions in which this secretion actually is impaired. The GFR is normal. So that's the one other condition in which you can have a normal GFR and still have hyperkalemia or high potassium. And those patients will need further workup. But the important differential to keep in mind, if you have a normal GFR and are having high potassium, you have to make sure that the blood is being drawn properly, because the red blood cells are very high in potassium. And if you draw the blood, have trauma, the tourniquet that we put in, or the phlebotomist puts a lot more pressure, those red blood cells can rupture, a process that we call hemolysis. And this hemolysis can release potassium into the blood and cause an artificial rise in potassium. So the short answer is that this can happen. You have to make sure that there is no trauma during the blood draw. Maybe remove the tourniquet. Don't clench your fist and then draw the potassium. If it's still high, then it will need additional workup. So that's the answer to your question. Now, we want to also welcome Yash from Sri Lanka, and he had a question about dialysis. And let me see what the question was. My dad is in stage 5, and he's not willing to go on dialysis. Can he preserve his kidney function only on, I think you mentioned tablets? So let me answer that. So the modality options for advanced kidney disease. So these are patients that they have advanced enough that they need some help. They need a replacement therapy. And the replacement therapy is either via dialysis, we spoke about that, or transplant, we spoke about that. But there's also something that we call conservative management. So conservative management means that you treat the patients with medications. So the short answer, yes, is yes, they can be kept comfortable. Now keep in mind that there are risks associated with that, but a lot of people don't want to go on dialysis, and rightly so, in my opinion. Sometimes dialysis can cause more problems, and they want to live whatever life they have left. They want to live it, as peacefully as possible. So conservative management is an option, should be discussed. Unfortunately, most of the healthcare providers in the US don't discuss that. I do. And how do you do conservative management? You control the potassium intake, you control the sodium intake, you control the phosphorus intake, you control the fluid intake, you control protein. And those are things that we do for conservative management. So it's definitely a viable option in the right setting once we have discussed dialysis and transplant, both with the patient and their family and loved ones. And if they still want to go with conservative management, that should be completely fine. There should be no issues with that. I think we are running out of time. I do want to answer a question from Brian Gillum. Brian Gillum is one of our superstar advocates, a kidney donor himself. And his question is, how important is it to do dialysis at home instead of a facility? So this is one of the slides that I always present. And this is once again for patients with advanced kidney disease. Home dialysis is at the center, whether these patients are coming from clinics, from the hospital, or home dialysis means that you dialyze at the comfort of your home. It has a lot of advantages, and we're going to do a separate program on home. But in this day and age, when you want to avoid exposure to COVID and other stuff, and avoid going to a facility where there are a lot of other people, then home dialysis is definitely a good option to have. So I think, Christina, to be mindful of time, we will limit this. I know there are a lot of other questions that were asked, and we will answer them, I promise. But just to be respectful of everybody's times, we will be finishing this program soon. I do want to thank a lot of people who were involved in putting this program together. One is Anita. If Anita, you can come on. And Christina Lopez, who have been very instrumental in putting these programs together and answering all the questions. I also want to thank our panelists, Marc Coronel, Cindy, as well as Jim Cunningham. And please do visit us on our website. Please do follow us on Facebook as well. This will be a recurring event. I know there were questions on ADPKD. Unfortunately, we didn't have time to answer them, but we will do another program just purely on ADPKD, or I can reach out to that person directly and answer those questions. So with that, Christina or Anita, anything else?
Yeah, I just wanted to thank everybody for joining. Just a reminder that since everybody's registered, our next event's going to be August 1st, so it's every month on the 1st from 5 to 6 PST. You'll basically use the same link, so just keep that link and you can use it on the next time we're joining in again. And I look forward to seeing everybody on the next event.
Thanks, Anita. Thanks for all your help. And we do have a note of all the questions, so we will go ahead and answer them and send an email to all the registrants. Thank you for joining us today. We really appreciate that.
Okay. Thank you, everybody. Bye for now.